Elbow pain from weight training is really common. There are multiple causes, but the most common causes for it generally are either lateral epicondylitis or medial epicondylitis, right? And what is that really? The layman's terms for both of these is tennis elbow and golfer's elbow. And one thing of note, whereas those are the two most common causes for elbow pain from weight training, there are several others. There certainly can have a fracture, you can have muscle tears, you can have nerve injuries. So if you notice any deformities in the particular forearm in comparison to the others, so for example, if your left forearm is bent outwards in a position that looks much different than your right, then obviously that's not a good sign. It's probably indicative of some sort of fracture. If you see any bruising or extreme pain of flexion or extension, these suggestions probably don't apply, and it's a good idea to go to an urgent care center and get some imaging done, because it could be something far more serious. Or if you have like referred pain that's traveling down your forearm, that's indicative of of a nerve injury. Now, granted, that's extremely rare, and the vast majority of the time that I have patients that complain of elbow pain, it's more mild, and it's usually secondary to things that they're doing in the weight room, right? Okay, so what exactly is tennis elbow? So as I mentioned, tennis elbow or lateral epicondylitis is inflammation right near the lateral epicondyle of the humerus. And what is apparent there is you have these tendons that attach to the lateral epicondyle of the humerus, and these are the extensor muscles of the forearm, the extensor carpi radialis longus and the brevis. And these tend to get overused when we are extending or twisting our arms in an inappropriate fashion, or just overusing them, perhaps training too often. Golfer's elbow, that actually refers to medial epicondylitis. And that, much like you can have inflammation of the lateral epicondyle, you can have inflammation originating from the medial epicondyle, so on the inside of your elbow. And over here, you have a couple more muscles. So whereas the extensor muscles of the forearm attached to your lateral epicondyle, so those are the ones that are involved with, extending your forearm up, right? Extending your wrist up. With your medial epicondyle, there are several muscles attached to that, both involved in flexing your forearm, so the flexor carpi radialis, palmaris longus, but also for pronation. One way to think about it is, so if you're holding like a bowl of soup, that's supination. If you're in the opposite way, the opposite movement is pronation. So supination, holding a bowl of soup, pronation, right? And so the muscles involved in pronation can also be affected when you inflame the tendons near your medial epicondyle. Okay, so those are the main the most common causes of elbow pain I see with weight training. Okay, so that being said, why exactly would you get these causes? So it's actually pretty simple, but sometimes we just don't think about this. So 1 second, let me go ahead with these individuals. All right, and get that here. Okay, so most common causes are simply just too tight of a grip. So when you guys are in the weight room and you're gripping your barbells or dumbbells, if you take way too tight of a grip, oftentimes you'll utilize either your flexor muscles or your extensor muscles of the forearm in an inappropriate fashion. Generally, and this probably comes into play mostly when we're doing bicep exercises or tricep exercises. One thing I always try to think about is when you're doing arm exercises, almost imagine like your hand is like as a hook, kind of holding the weight in place, right? And keep it in a neutral position so you don't involve your form as much, and really try to focus on squeezing either your bicep or tricep muscles during the movement. And this is true for myself when I first started. Many times, particularly if the weight is too heavy, we tend to extend or flex our muscle, and that oftentimes can lead to well, to tendonitis in those particular areas and muscle strain too. So I kind of touched upon this, a non-neutral grip. So make sure your grip is neutral throughout the movement is key. Remember, we're always trying to focus on any type of movement that you do, focus on squeezing the muscle group that you're working and focus on building up that mild muscle link, that neuromuscular link, because that way you can activate as many fibers within that muscle as possible and limit the amount of work that you do on tendons. Remember, we're working muscle fibers, not tendons, right? Another thing that's really key, too much weight. I am a big believer in keeping patients or keeping rep ranges on the higher side, particularly as we get older. I'm in my 40s, right? A lot of us are. We're not trying to, turn into competitive powerlifters. You can still get great hypertrophy, muscle growth, staying within the 8 to 12 rep range. In fact, most of the time I keep my rep ranges 10 reps or so, 8 to 10 reps. And I find when you do that and you use good form, right? Making sure that you take a second on the concentric or positive phase of the movement, holding for a second at the very top without locking out, and then taking 2 seconds on the negative or eccentric movement. It's really hard to use a tremendous amount of weight. But at the same time, you can still get a great workout and you can still stress the muscle fibers. It's really remember, it's more about muscle contraction. It's more about time under tension than it is about, being like a weight room hero. And then the last thing, of course, is overtraining. So for more advanced individuals in the weight room, if you are doing like a day for a particular body part, it's probably best just to work it once a week. Like for example, I've been training for a long time, and I do a 5-day split for my body parts. So I'll do back one day, and then chest and legs, and then shoulders and arms, right? And I typically hit each muscle group once per week. Um, for individuals that are doing total body workouts, well, that's a little bit different because you're doing less exercises per body part. And I think in that particular case, hitting twice weekly is fine. But, if you are, doing 4 or 5 exercises for a body part and you're trying to hit it, 2 or 3 times a week, that's just a recipe for overtraining. And certainly you're at higher risk for tendon problems too. So remember, this is in the 70s. We're not trying to train 3 or 4 hours a week like Arnold and everybody else did back in the day. That's not conducive. Ideally, you should go in, get into the weight room, get your workout in for 45 minutes and get out, and really try to use good form and focus on the muscle group. Again, focusing by not using an excessively tight grip, using a neutral grip while you're performing the weight, using an appropriate amount of weight that you reach failure within that 8 to 10 rep range, and then of course just hitting your muscle groups once a week or so. So let's say you've done this though. But let's say, all right, well, you got the pain, you didn't do those things, and it is what it is. It happens, right? So what are the best treatments for it? Well, tried and true treatments are Nsaids and ice, right? So I'm a fan of Aleve. I like it a lot. It seems to be a little more gentle on my stomach than the other Nsaids out there, naproxen. And using 200 to 400 milligrams every 12 hours for 7 to 8 days is perfectly fine. Now, some of you may have heard about how Nsaids can cause GI distress, or in individuals who have kidney issues can decrease blood flow to their kidneys. You guys are healthy. That's not a huge issue. Now, if you do have issues with GERD, using a smaller dose, like maybe 200 milligrams twice a day is not a big deal. Even 400 milligrams really shouldn't present much of an issue. The issue, of course, is NSAIDs have the ability to decrease the mucosal lining of your stomach and make it more likely you can get an ulcer. But really, this only becomes an issue if you're taking more than like 1,000 milligrams a day and you're doing it for like 3 to 4 weeks. So if you use, under 1,000 milligrams a day, so 800 milligrams for like a week or so, that's perfectly fine. Another thing you may want to do is ice cup massage. Now, you can all, people intuitively know about icing the area. and that certainly can decrease inflammation. But one, unique thing that some of you may have already done, but I occasionally do if I incur an injury, is to take like a 3 to 4 ounce paper bathroom cup, right? Something like this, right? And put it in the freezer, fill it up 3/4 of the way, put it in the freezer, obviously allow it to freeze, and then tear away about 3/4 of the cup. So you have this like this block of ice that's formed, right? And it should be pretty flat. And then what I typically do is you rub that along the affected area for 5 to 10 minutes daily, and that seems to really reduce inflammation and make things better long term. And it really seems to work. And it's because obviously the cup's really easy to hold, and you can kind of encircle it around the area, either your lateral, medial, epicondyle. Another thing that is useful are braces, and you can find these on Amazon. They're just like these, you've probably seen them before. They're braces that encircle the forearm, and they have like a gel pad that overlies either your medial or lateral epicondyle, and the pressure there seems to kind of help with healing. One thing that is kind of interesting is cross fiber massage. So I have mentioned active release technique for a few of my patients who suffer from shoulder pain or back pain or knee pain, which is basically the idea where you work with a trained professional that will actually break up muscle fibers around those joints, which many times can help with joint pain if there is like an entrapped nerve, or help with mobility. There have been a couple of studies that have shown that it's been very effective for individuals with frozen shoulder, basically older individuals, where they may be utilizing their shoulder one day and all of a sudden their shoulder's locked in position. Using ART rather than surgical surgical modalities has been proven to be pretty useful for them. And I have a video that kind of gives a pretty good demonstration of cross fiber massage for tennis elbow, and for golfer's elbow. It'd be very similar, just be on the medial side of the elbow, and we'll get into that in a second. And then finally, just form exercises, right? So for the more advanced lifters, you do get a fair amount of forearm work with pulling movements and pushing movements, particularly during back and chest workouts. But when you're first starting out, your forearms may not be developed enough to handle a lot of weight. So throwing in 1 to 2 sets of forearm extensions and forearm curls at the end of your arm workout is probably a good idea to strengthen your forearms and get them up to snuff with, so that they won't overpower. So you won't overstrain them, or they'll be strong enough to help support your arm during heavier movements when you're doing back, chest, or biceps or triceps, right? And so that's something that may be a good idea. I used to do that a lot when I was first starting out working out. And then here's a really good resource. So Bob and Brad, they're these two physical therapists that have been around for a long time. They kind of have like their channel is kind of goofy. It's funny, and they have this great camaraderie. So they're pretty entertaining to watch. But they provide some great information about physical therapy techniques to alleviate certain musculoskeletal injuries, right? And so they have this great video on tennis elbow. And as I had mentioned, cross fiber massage is one technique that has been proven to work pretty well to alleviate tennis elbow. And Brad actually does a great job demonstrating it here. So let's go over here. So I think it was right about here. Okay. So he's going to demonstrate cross friction massage right here in a second. So again, it's really simple. You're basically, as these individuals mentioned, breaking up scar tissue in the area, but that seems to really help quite a bit. Even though it appears to be a tendon strain, it seems to help with pain in that area significantly, doing it 15 to 20 minutes a day. And there's been some studies that have shown that it's really made a big difference in terms of helping with pain associated with lateral epicondylitis. Now, of course, that video was demonstrating the cross fiber massage for lateral epicondylitis, but it can also work for medial epicondylitis too. So that was just my little quick presentation on just dealing with two common forms of elbow pain that you might experience from weight